Amanda.
And my name is Kelsey. Today we are going to be teaching you all about smoke exposure risks.
You may be wondering, what exactly is smoke exposure? Well, don't you worry, because we're about to teach you all about it. So, Kelsey, what exactly is smoke exposure? Those are some big words.
They are. Passive smoking means breathing in other people's tobacco or marijuana smoke. Passive smoking is when you breathe in the air after someone around you who smokes breathes out. And today we're going to be talking about two types of passive smoking, secondhand and third-hand.
Secondhand smoke exposure is the combination of smoke from the burning end of a cigarette or blunt and the smoke exhaled from the person smoking. This happens when you breathe in smoke from a burning cigarette or blunt and you also breathe in the air of someone who's breathing out the smoke.
The second type is third-hand smoke. This is when you touch a surface, like a tabletop or a pillow, that has tiny little particles left on it from the smoke.
So today we're going to focus on two types of products that create smoke exposure risks. We're going to focus on tobacco and marijuana. So what is tobacco? Tobacco is a plant grown for its leaves, which are smoked, chewed, or sniffed. This tobacco contains a chemical called nicotine. This is an addictive substance. And we're going to talk about marijuana. Marijuana is a psychoactive drug from the cannabis plant used primarily for medical and recreational purposes. The plant contains chemicals which can act on your brain and change your mood or your consciousness.
What can second-hand and third-hand exposure of tobacco smoke do to your body? Exposure to second-hand and third-hand tobacco smoke can lead to many health problems in infants and children, like frequent ear infections, coughing, wheezing, shortness of breath, and lower respiratory infections like bronchitis and pneumonia. And in kids with asthma exposed to second and third-hand smoke can have more frequent asthma attacks. No fun. Younger children are at an increased risk of third-hand smoke due to the tendency to explore the world by putting things in and near their mouths. The best way to prevent this is to designate a smoking area outside or a specific room, and always keep kids away from things that are contaminated with smoke, and clean your surfaces regularly.
Now we're going to talk about what marijuana can do to your body. So as cannabis use or marijuana begins to rise, we need to explore the effects that can have on your child's health. It's important to remember that any smoke exposure is harmful to not only their lungs, but their entire body. So, secondhand exposure. A pediatrician named Dr. Wilson, she conducted a study to identify the effects of secondhand marijuana exposure. It revealed that children who are exposed to secondhand marijuana use have marijuana metabolites in their urine, meaning the THC from the marijuana enters not only your system, but their systems too. It is believed to put them at a risk for viral infections such as bronchiolitis, asthma, and other respiratory illnesses. So kids, what does this mean? This means that marijuana will enter your body when exposed to secondhand smoke. This can increase your chances of getting sick. Now, in regards to third-hand exposure, when children are exposed through surfaces containing particles of the marijuana, this can also increase their likelihood of negative health outcomes. The average particle concentration is 0.01. So these particles probably remain on clothing, furniture, and house dust, where children can breathe in the particles or even swallow them after touching their mouths. There hasn't been quite enough research done to identify the specific effects of third-hand exposure, but they're believed to result in the same negative health outcomes as tobacco products. So kids, when you touch a surface that has smoke particles on it, like a couch or table, and then touch your nose or mouth, it exposes you to tiny little pieces of marijuana that you can't really see. We still don't know exactly what this does, but we have a good idea that it can impact you, like what we talked about earlier with tobacco with Kelsey.
Above are some additional resources to learn how to reduce exposures and the dangers of second and third hand smoking. EPA.gov and centerforresearch.org.
It's crucial to reduce smoke exposures to create optimal health for your children and yourselves.
Thanks for watching!